Good afternoon and welcome. Welcome to the Public Health Practice Grand Rounds for October 2009. My name's Molly Mitchell and I'm the coordinator of the Mid-Atlantic Public Health Training Center, and on behalf of the Training Center and the Department of Health and Mental Hygiene, I'd like to welcome you to our presentation of Safe Streets, a public health approach to reducing gun violence. Before we begin today's presentation, I'd like to invite you to visit our website to view our upcoming trainings, which include our core competency training series with Dr. Carolyn Fowler, and that includes trainings such as practical grant writing and logic modeling coming up this Monday on October 26th, as well as professional partnerships and making data work for you on November 12th. And we're also pleased to offer public health problem solving with Dr. Miriam Alexander on November 6th. And for those of you who are watching online, we invite you to email questions for our presenters at any time during this broadcast to our email address at maphtc@jhsph.edu. And if you are watching online, we ask if you're watching in a group to please take a minute to fill out our sign-in sheet that's on our website to let us know how many people you're watching with. That way we can have a better count of our online participants. And with that, I'd like to introduce our first speaker, Dr. Daniel Webster. Daniel Webster is Associate Professor of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, where he serves as co-director of the Center for Gun Policy and Research and as an Associate Director of Research for the Center for the Prevention of Youth Violence. Dr. Webster has published numerous articles on firearm policy, the prevention of gun violence, youth gun acquisition and carrying, firearm injury prevention, intimate partner violence, and the prevention of youth violence. With Johns Hopkins colleague Jacqueline Campbell, Dr. Webster has been involved in groundbreaking research on predictors of homicide involving intimate partners. This research led to the development of the Lethality Assessment Program, LAP, that is operating in 9 states. He is also currently leading studies evaluating the effects of various efforts to reduce violence, including state gun and alcohol policies, policies to reduce illegal gun sales, and intervention designed to encourage protective measures for victims of domestic violence at greatest risk, and the Safe Streets program. Dr. Webster's expertise in the prevention of gun violence has been sought by mayors, police chiefs, health commissioners, state and federal legislators, judges, foundations, and community groups. He has taught violence prevention at Johns Hopkins for the past 17 years and serves as a core faculty member of Johns Hopkins Interdisciplinary Training Program in Violence Research. We also have joining us today speaking Lori Toscano. Lori Toscano has 12 years of experience in working with at-risk and delinquent youth. Ms. Toscano's current role is providing technical assistance and monitoring to the community-based organizations that are implementing the Safe Streets initiative. She is a graduate of Towson State University and possesses a degree in interdisciplinary studies with a concentration in law enforcement. And Danté Barksdale joins us, who's also a Safe Streets outreach worker. Danté has been working for the past 2 years with Safe Streets and is also a hospital responder for the Safe Streets program. And with that, I'm going to turn it over to our presenters. Thank you.
Thanks, Molly. Very excited that you selected this project to focus on for this particular Grand Rounds. It's something that, as you alluded to, I've been teaching a course here on violence prevention for 17 years. Yet I think we're still struggling a little bit to really make it a more mainstream idea that this is a public health problem that we can approach with public health strategies that have been proven effective in other kinds of public health problems. I want to start our discussion today talking about the public health burden of gun violence, and just on a national scale. Nationally, in the United States, for males ages 15 to 29, the rate of gun homicides is 20 per 100,000 population, a really astounding number. And that makes it the second leading cause of death for that subgroup of the population. If you look at a strata of black males in that age group of 15 to 29, gun homicide is the leading cause of death. The most recent year of statistics, over 4,000 young black males ages 15 to 29 lost their lives to gun violence. There are a lot of different ways that we can use public health perspectives in thinking about how to approach this problem of gun violence. As epidemiologists, we can, a starting point is who's most affected? Who are the high-risk population groups? Another thing we commonly do is think about what are the direct behaviors that lead to these tragic health outcomes from gun violence? And are there attitudes that support those kinds of behaviors? Or there may also be relevant social skills, just as is the case in many other kinds of health behaviors that public health departments deal with. For those who have worked in infectious disease control and prevention, you're probably familiar with notions of social contagions and sort of how epidemics, now of course we're all focused on the flu and how that gets transmitted. And for those who've been studying gun violence like myself, we've found that gun violence actually looks a whole lot like an infectious disease process in terms of how it is distributed in a population over time. We have very classic epidemic curves. If you plot over time shootings and gun homicides, they have this very rapid increase as an epidemic really peaks, and then often a very rapid fall off after that, and it tends to cycle much like a lot of infectious diseases. It also tends to do that in spatial ways as well, that a shooting in one place can often lead to another shooting nearby, and it can propagate spatially, again, much like a social contagion. In public health, we're also interested in environment. How does the environment affect the outcome that we're interested in? And that's clearly the case with gun violence as well. What are the kind of environmental conditions that facilitate or impede gun violence? How available are guns? Is there concentrated poverty or not? Those kinds of things. While I'm going to focus on one very particular approach to this problem of gun violence, I want the audience to appreciate that there are a pretty long list of potential strategies that have been used or have potential to have an impact on this problem. As Molly mentioned, I focus some of my work on gun policy, so of course one thing that as public health people we've been interested in is reducing the availability of guns to high-risk individuals and in other high-risk contexts. We're sort of unusual in the sense that I think, criminologists has been looking at this problem for a number of years, and they don't necessarily think of it as public health sometimes does, where perhaps we can reduce the lethality of guns, not only whether a shooting will occur, but how lethal is it. So how guns are designed could be very relevant. Another sort of situational context we can approach is when there are disputes that have the potential for leading to a shooting, can you go in and sort of cool the emotions and find ways to mediate those disputes? We often, in looking at public health problems, the place we start in our epidemiological studies is look for risk factors and protective factors. And of course, that is relevant for gun violence prevention as well. So you want to promote the kind of things that seem to be protective, like being in secure jobs, being in close, nurturing family situations. And you want to reduce risk factors, addiction, for example, as one. And as I alluded to before, a common way that we address public health problems, including gun violence, is to try to promote the most relevant social skills and more generally, pro-social development. This is sort of a broader mental health promotion approach. And then finally, just as we've seen remarkable changes over the past couple of decades with respect to social norms, whether it has to do with smoking, drinking and driving, wearing seatbelts, a number of different kinds of norms, we've been able to change over the time through a variety of strategies. And again, those strategies could be quite useful and relevant to the prevention of gun violence. So now let me talk about the very specific approach we're going to focus on for today's discussion. It began in Chicago in the late 1990s. It was developed by a public health professor at the University of Illinois Chicago, Gary Slutkin, who had spent most of his professional career on prevention and control of infectious diseases like HIV, AIDS, tuberculosis. And he started something called Ceasefire, a campaign to stop shooting. I'll briefly just sort of work you through what this model looks like, where, of course, what we're focusing on is reducing the level of violence. And the way you do that is for people who might be in situations where they might have an idea that they might want to shoot someone, you want to give them alternatives. What are other ways to deal with that approach? You want to change what the norm is, change the norm that if someone disrespects you, then that is justification for shooting someone. You also want to try to alter the sort of perceptions of the potential risk and cost associated with pulling a trigger. And the way this program seeks to do this is through using a variety of components in this program, one of the most significant of which is the street outreach program, where street outreach workers, many of them who have been in the same kind of situations that the high-risk groups that we're trying to reach have been in. They're generally from the same communities that they're working in, so they're kind of known and trusted in the group that they're trying to reach. Dr. Slutkin came up with this idea because it had been so effective in some of the strategies and programs he'd been working in controlling HIV and AIDS with, for example, using former sex workers to go out and do outreach to sex workers to use safe sex practices. In terms of trying to change what the norms are, this involves a much broader community effort and many different components of the community. Clergy are often very key in this and trying to establish sort of the sort of moral climate of the community and sort of set the tone for what is and isn't okay. But of course, you got to go beyond clergy if you're going to reach the individuals you're trying to reach. So part of this effort has to do with reaching out to other groups and entities that have contact with the youth and others at high risk for involvement in gun violence. And then there's also an educational component to this too. And in Ceasefire, I'll show you some of the educational materials that they've used to try to send messages about what the norms really should be. And finally, while I want to be clear on one thing, this, let me see if I can get the pointer to work on this. The role of police and prosecution, oops, back here. This is not a formal component of the Ceasefire program itself. It's very important that this effort come from a community or from a public health agency as opposed to a law enforcement, if you're going to get the trust of the individuals you're trying to reach through this effort. The police, however, and law enforcement are very important because their role has to do with this notion of what are the risks and costs associated with you reaching for the gun and pulling the trigger. And that message can be brought to these tense situations that are going on to convey what the true risk and cost are. But they're separate. The police part is very separate from how this program unfolds. So I'm just going to show you a few pictures very quickly here. This is outreach workers in Chicago connecting with clients. Here's some of the posters using very simple messages of that should speak to people. And they have somewhat different target groups. And I'll show you a variety of what these posters and billboards and things look like. If you think that a shooting might take place, be the one to stop it. So they give numbers. This was a very effective one that was tested in focus groups, and actually we found in our interviews with crime-involved youth that this was a very powerful thing when they thought about avoiding gun violence and some of those problems. They tended to think about, well, I don't want my little brother to get hurt, or you know, my cousin or something like that. Pointing out, again, something to point out the cost and risk associated with gun violence. So there was an evaluation that was published last year by researchers from Northwestern University evaluating Chicago's ceasefire program. It was a very rigorous evaluation that looked at 7 different neighborhoods in Chicago that implemented this program, and over a very long period of time they examined the data. Each of the sites had a minimum of 33 months that they had been implementing the programs. Excuse me. Just to summarize, what the researchers found is that they found significant downturns in shootings in 6 of the 7 areas, and in 4, it was clear that they were linked to the program, because in the nearby comparison areas, there was no such change of that type of magnitude. The range of what the estimates were went from a reduction of 16% to 34% reduction in shootings. And in 4 of the sites, retaliatory gang homicides, which are precisely the kind of thing that this intervention is trying to address, they were virtually eliminated in those sites. So in my mind, while you cannot say that the program definitely worked in every single site, there were some major success stories in addressing one of Chicago's biggest public health problems through this intervention. In addition to those kind of public health outcomes, the researchers also did surveys of the outreach workers' clients, and they found just how important the outreach workers were to this group that often didn't really have much of a support group. They were often one of the most significant people in their lives to help steer them in a positive direction. And the final thing I'll say about this is that this very long report documented just numerous difficulties in implementing this program. It is not in any way an easy program to implement, but despite those challenges and hurdles in implementation, it appeared to have very positive effects in most of the neighborhoods in which they implemented the program. My role most recently has been in evaluating the effects of this program in Baltimore. The program was brought to Baltimore. And before I go through our findings of our sort of interim evaluation, we will be doing more work beyond what we're going to report today. I want to now turn it over to Lori Toscano to talk about how the program was implemented here in Baltimore, the role of the Baltimore City Health Department, and then Danté is going to talk about the work that he does as an outreach worker.
Hi, everyone. I'm Lori Toscano. I'm the community liaison for the initiative through the Baltimore City Health Department. And I'm here to give you a little bit of background about how Safe Streets came to Baltimore. So in 2002, the Baltimore City Health Department, in conjunction with the mayor's office, responded to the ever-increasing epidemic of youth violence by creating the Office of Youth Violence Prevention, which is housed in the health department. What we did after that was really focus on looking at ways to provide intensive services to juveniles who are most at risk of becoming a victim or a perpetrator of gun violence. Since that time, what ended up happening was we had someone who was an amazing woman, Catherine Fine, who is no longer with the health department, but she started researching other initiatives and other programs nationwide that were having a positive effect on reducing gun violence, specifically with juveniles. And that's how she located Ceasefire. We applied for a grant with the Department of Justice, the Office of Justice Programs, and we received that grant in 2005 to implement the Ceasefire model, which then became Safe Streets. In February of 2007, we put out a request for proposals for nonprofit organizations who were interested in implementing this model. The way that was determined was by a couple different determiners, but ultimately it was based on 14 community statistical areas that had the highest amounts of shootings and homicides in their areas, as well as the neighborhoods that abutted those statistical areas that were in the top 25% of shootings and homicides in Baltimore City. It's a very lengthy process, I have to say, the whole bidders process, because what we're doing is we're asking nonprofits to apply and to say how they would be able to implement this initiative. The difficulty that we've found with this is a lot of the times, when you apply for grants, you receive funding to kind of create your own programming or to implement something that you've created. And this is different in that we are implementing Ceasefire with 100% fidelity to the model. At that time, we released the request for proposals. We received a lot of interested individuals, but the one that was most successful at that time was the Living Classrooms Foundation. And in June of 2007, Living Classrooms kicked off our first site here in East Baltimore, actually only a few blocks away on Monument Street. Since that time, we've actually expanded as well. So in November of 2007, we began working in Southwest Baltimore. Unfortunately, it was very difficult in that area, as we've determined, and as I was saying, it's very difficult to be willing to do this with fidelity. The biggest issue is you have to hire the right individuals, and Danté Barksdale, who will be speaking after me, is one of those individuals. We found that if you don't do that, which is really the biggest piece, if you don't have that outreach component, as wonderful as it can be, if you're not doing everything and having credible messengers, often it's not a success. And unfortunately, that site ended in June of 2008. However, in February of 2008, our East Side site expanded to another community. It started in McElderry Park, which is post 221 here in Baltimore. And in February, it expanded to post 223, which is Elwood Park. So contingent right to that community that was already working in. In addition, in December of 2008, not only did that site expand again north of their current area into the Milton, Montford, Madison East End community, but we also opened our Cherry Hill site, which is our second site that is in South Baltimore. So we have one in East Baltimore and one in South Baltimore. Again, I would say that the most important things that we look at when we are trying to implement the initiative in a Baltimore community is partnering with a group that understands the model fully, that is willing to hire most often ex-offenders who may have lengthy records, who have been a part of this lifestyle, but who we have found and through Ceasefire have found are the most credible messengers, the individuals that are able to not only prevent violence, but also prevent retaliations. With the Baltimore City Health Department, once the sites are implemented, our main role is to provide technical assistance and monitoring. So we partner with Ceasefire, who comes out and does the training for our outreach staff, It's in excess of 40 hours, very intensive training, out on the streets, really walking the individuals through what could happen when mediating a conflict, building relationships, building rapport with the highest risk individuals, so those individuals who are most likely to be perpetrators or victims of gun violence. In addition to that, we provide the monitoring, making sure that everything's running smoothly, assisting our partner sites, Living Classrooms Foundation and Family Health Centers of Baltimore, with providing them with whatever tools they feel that they need to combat this issue. And just to really put it out there, I mean, this is not something to take on lightly, and these groups have done an amazing job and are committed to seeing Baltimore and their specific communities become safer communities. These individuals are working non-traditional hours, 6 p.m. till 2 a.m. They're out on the streets when the majority of us are at home sleeping and watching the news and hearing about what's happening in our communities. These individuals are actually there on site. In addition to that, the Baltimore City Health Department has recently partnered with Johns Hopkins as well to implement a hospital initiative, which is where our certain staff who have been, again, intensely trained are now able to respond to the emergency room when a victim arrives. So if there's a victim in our East Baltimore community, a staff member such as Danté would be able to come to the hospital and speak with the victim at their bedside and try and prevent further retaliation. In addition to that, with being a part of the Baltimore City Health Department, I would like to extend my appreciation for it being with the health department. This is really, I feel, groundbreaking that our Baltimore City Health Department is recognizing violence as a public health issue and is working to reduce violence in using public health strategies based on Ceasefire, who we could not do this without. With it being under the health department, we also benefit from partnerships with other city agencies. So we're able to assist our participants, the individuals who come on board and are looking to change their lives, with housing referrals, with job placement, with educational benefits, really anything under the sun because of the partnership with other city agencies. In addition to that, just to give some information before Danté goes into the specific work he's doing, so we've been up and running since June of 2007, and since that time, we've worked with 365 of the highest risk individuals. And by highest risk, we're talking about individuals who are most likely to be shot, most likely to perpetuate gun violence. They may be individuals who are associated or affiliated with a gang or a crew. They may have recently been released from prison. They may have a lengthy history of perpetrating crimes of violence. And to work with that many individuals and to have a staff that are committed to that, I think just goes to show why looking at gun violence as a public health issue is very important. In addition, the staff has completed over 140 high-risk mediations. So these are mediations that whatever the underlying cause is could have resulted in a shooting or homicide, or could have resulted in a retaliation shooting or homicide. And then, as Daniel was saying, the public health education, the messages that we're trying to send with our signs. I don't know if anyone's seen our posters, but we have a lot of posters around that say, stop shooting, start living. And to date, we've handed out over 60,000. So the Baltimore City Health Department, in conjunction with the Baltimore City government, is really committed to trying to reduce shootings and homicides in this manner. And that's it for me.
Good afternoon, everybody. My name is Danté Barksdale, and what I do is outreach for Safe Streets. And this is a very, very demanding job for the outreach workers. Actually, you have to be like a very unique person to do this job. And I say that because I grew up around here. I hung in every neighborhood that surrounds the whole Johns Hopkins hospital, and it's been tough growing up in this neighborhood. Guys use guns, just to resolve their problems. They feel nobody can disrespect you. That's a sign of weakness. Nobody can take nothing from you, you know, stuff like that. And this is what's being taught in this neighborhood, in this community. So what Safe Sts does is hires ex-offenders like myself and the rest of the outreach workers, because we have an outlook on like what goes on in the community, because we have similar backgrounds. You know, I used to do everything you could think of. And most of the time it was just out of fun and, you know, not having nothing else to do, not knowing no better. You know, somebody say, let's go do this, and we just go do it, you know. But the Safe Sts thing, you know, is like it's therapy for outreach workers too, because like now what happens is I used to like hear about people get shot all the time, even see it. And I really didn't even have a thought about it. It'd just be like, Joe Blow just got shot. And with Safe Sts, it has brought in my awareness, you know, to understand that like the way that the guys think in this neighborhood is not normal. It just became normal, you know, through the conditions, you know, growing up, you surrounded by drugs, you surrounded by violence. So I think what happens is most of the brothers just adapt to it because it's their lifestyle, and what they want to do is they just want to fit in. So Safe Sts is here to like tell the brothers like, look, man, resolving your conflicts with gunfire, it's not good. Resolving your conflicts, stabbing somebody, trying to bust somebody upside the head is not good. What's being taught from the outreach worker now is like, learn how to forgive people, you know, because people are human. People do things that they don't supposed to do, but it just shouldn't cost somebody life. And I've seen people's lives get taken for, you know, small stuff like people brush off their shoulder, you know. So these mediations that we do, you know, they're very intense. You know, I was working for Safe Sts for probably 72 hours. And like, I was going out on my canvas. And this street right here, actually, I think this is Jefferson Street. If this is Jefferson Street, I can see the hospital at the end of the picture. And I was walking up this very street. And as I was walking up the street, I seen a Lincoln Town car, an old one with dark tinted windows, and it was sitting in the middle of the street. And the guys, it was one guy, as I'm walking to the car, you know, you can see through the tinted window if you stand in front of the car. And I could see a guy in the back of the car, and I could see that he had a gun. But his friends were outside the car. And they're talking back and forth to about 15 other guys. And I don't think that these other guys were aware that this guy was in the back of this car. So as I pulled up, I had about a stack of flyers in my hand, and I started passing them to the guys. And I started saying like, somebody might, this don't look good. I said, cause that boy in that car got a gun. And the other guys that were standing there, they was looking. I said, yeah. And I said, nobody shouldn't die. I said, what's going on? They said, the girl said, such and such said, such and such said. And I said, the girl? I said, well, where is she? She wasn't there. You know, and I said, so actually somebody, you know, has the potential to die right here. Somebody might, you know, go to prison for the rest of their life. And we're going to have a few new snitches. Because somebody is going to tell what they see out of these 20 guys, you know, and all we're going to do is have a bigger problem. You know, there may be some retaliation, stuff like that. So as I was talking to the guys, a couple of the other outreach workers knew a few of the young guys, and we were just mingling with them. And after about 20 minutes, 25 minutes, we were all laughing. And what that taught me was that, like, at that time, if you have like a positive force, you know, around when something is going, you know, taking place, and this positive force is a person that they know, somebody that they're familiar with. They seen me sell drugs, they seen me do all sorts of stuff. But today, they see me in a different light. And that light is to try to bring forth like peace in our community. You know, this is not normal, don't do that. You know, it's a lot of things that we were taught that's not normal, but it's normal here. So like the thing is to change the norm, change what's slick. You know, it's slick if somebody smack you to go back and blow his brains out, and everybody will praise you, but what they don't understand, when you get that life bit, that audience not going with you. You taking your family to prison. All it does was lead to more destruction. You know, so in our caseloads, you know, most of the outreach workers, we have like caseloads. You know, I have 16 clients. I got about 7 of them working, about 3 or 4 of them, you know, they school. And then I got a couple of knuckleheads that just goes back and forth over to jail, you know. But I feel like if one of them did something right, then, you know, we moving towards something positive. So, like the outreach worker, man, is like, it's tough, you know, because when I first started working for Safe Streets, this was the first thing that happened to me too before this mediation. They said, we have the media is coming, and they want to interview one of y'all. So it just so happened they picked me. And I said to myself, I have to walk down Monument Street through Glover, and I'm with these 2 tall white guys, and they got cameras. So, you know, at that time, I was thinking like, snitch, they gonna think you're a snitcher. But I'm thinking it in my mind. But as I'm walking with the guys, I could see the responses, you know, from the body language of brothers who knew me. You know, they didn't even think nothing like that. They was, oh, that's Danté. Well, they called me Tater. They said, that's Tater. I guess they interviewing him or whatever. And some of the guys heard what I was telling the reporter about what we need to do to straighten up the streets. And the thing in a nutshell is to have, like, you know, guys from the street. That's the only way it's gonna happen. You know, you have to get brothers who are in that environment that are the most influential and get them to change their mind about how they think about the streets, how they think about selling drugs, how they think about, because these guys are like businessmen. If they go to school and, you know, do all the things necessary, I think we would have a lot of pretty successful guys. You know, I've been to prison. I was there for 8 years, and I know a lot of creative gentlemen. They can do like almost anything with nothing in there. You know, make cards, write books, do all kinds of things. So what needs to be done is that we just had to change the social norm, and that's change what they think is slick. Education is slick. Forgiving somebody is slick. You know, being kind, saying something kind. You know, I even had to, like, I've been working on my facial expressions. And that came, like, with, like, my children. They said, Daddy, when you come into school, you always look upset. And I didn't know I was looking upset. I just, when I walk into school, you know, I see a few things that don't supposed to be, and I'm looking, you know, and, like, that's just something I got to change, just my body language, you know, because a lot of communication that people give off, you know, some people miscommunicate it, you know, and, like, I've seen guys do things like have a swavel with a guy and just walk. One guy may just walk away. And that's not good because both of them left in suspense, like what's going to happen. So both of them now are looking for one another. And that one guy may have just walked away because he was just walking away. You know, or it's just so, it's a lot of things that we need to change in this neighborhood. And I think like that Dr. Daniel Webster, you know, the John Hopkins, the living classrooms, the health department, because now we see that there are people in our community that want to help, and I want to help, and I want to do everything that I could possibly do to help this initiative to stop the murders, to stop the killings, because it's not normal. I have so many friends in graveyards and in penitentiaries and prisons, and they ain't coming home. They might never see the streets again. And now it's like second generation, because I'm a little older, their sons are going to prison, you know, and so it's just so much stuff we need to do, you know, and mediations and, you know, thinking for change classes like we do like events just to, you know, build rapport with the community so they can know who we are. You know, I even like the thing now when we walk down the street, you'll hear little guys say, here come them Safe Streets guys, you know, so if I hear that, I heard the word safe. So I know in his psychological, you know, he's saying safe streets. So he thinking he can't do that while we walking down the street or we canvassing the neighborhood. And, you know, they see the stop the shooting signs and stuff like that. And I think what's happening, I think it's getting better. Even though it looks bad, I think it's getting better. And I just pray that it keep getting better. And I thank y'all for coming. Y'all.
All right, thank you, Lori and Danté. You probably won't be surprised to hear that Danté was the most favored guest lecturer in my course last year. So as Lori was describing, they brought the ceasefire model to Baltimore under the heading of Safe Streets. And it began in McElderry Park, very close to our campus here. And it was officially kicked off in June of 2007. But of course, it takes a while to get folks on the ground, to get clients developed and things like that. So for our evaluation, we sort of had to make some somewhat arbitrary decisions about when we assume that a program is now fully in place. And using the implementation data that the health department collected with the community organizations implementing the program, we decided that in August they were sort of in full implementation mode. Just going to share with you a little bit of information from the implementation data that's being collected on a regular basis. Individuals like Danté complete forms about what they're doing, the kind of mediations and client contacts that they're having. Lori manages that information and thankfully shares it with the evaluation team as well. The yellow bars here are McElderry Park. As you see, they got started in August, and this is just plots face-to-face client contacts in months. And so you can see in August of 2008, they had over 400 contacts with high-risk clients. Very impressive. Union Square, that was the neighborhood that Lori referred to that was awarded a contract to implement this program. It was in southwest Baltimore. It frankly never really got off the ground and was implemented in its full way as it was intended to. Even though their funding started in, I believe, in the fall of 2007, they really didn't get anything going until the spring of 2008. And finally, their contract had to be terminated. Elwood Park, they began implementation beginning in the winter of 2008, but in more full force in the spring of 2008. So we have been examining, well, let me first show you some of the information on conflict mediations. Again, McElderry Park, the first neighborhood to implement the program, you see 8 mediations in August. We were really, frankly, very astonished at how quickly this group got out there and developed contacts and was able to start mediating very, very serious disputes between gangs and a variety of very dangerous people. And I frankly will never forget the meetings, sitting in with these meetings where they're discussing some of the things that were going down and how they were intervening. And I just frankly shook my head in amazement about what they were able to accomplish to head off shootings. Our evaluation is principally focused on looking at what impact does the program have on non-fatal shootings and homicides. But because, as we've been talking about, fundamental to this program model is changing attitudes and ideas about what's normal, what's right, we felt it was very essential to gather information of that sort from the groups being targeted by this intervention. In our original plan, we had hoped to gather that kind of attitudinal data from the clients of outreach workers. That turned out to be a difficult thing to do from the community's standpoint, the community group implementing the program, because they were just really getting established. And the last thing we wanted to do as researchers and evaluators is to jeopardize the kind of relationship building that is necessary to do this kind of work. as Danté was describing, it's clear that how important it is to develop trusting relationships with people on the street. And as soon as they're out there developing these client contacts, we don't want to say, yeah, we're going to drag you into being in a research program. That's wasn't going to work. So we did community surveys of young males ages 18 to 24 in McElderry Park and in the Union Square area, which the plan was to be full implementation there, but that didn't work out. And in a comparison neighborhood very close to here, just north of our campus in Oliver. The reason in this slide says the study design was Plan C is any good researcher, and I teach a course in evaluation research here, knows that ideally you want to get measures prior to the intervention. So you do a pre and post kind of comparison. Well, the way events sort of evolved, that really just wasn't possible because of various delays in our original design and in getting IRB approval. But we were able to do these surveys about 5 to 6 months after McElderry Park had been in full implementation, and have a couple of useful comparison sites from Union Square and in Oliver. Just to give you an idea of, these are the attitudinal questions. These were anonymous surveys done on the street. The data were collected by young men who were familiar with the neighborhoods, and they approached people on the street, and actually we got a fairly good response rate. They asked these kind of questions. This is a self-administered, anonymous kind of questionnaire about whether they thought it was okay to shoot someone under a variety of different contexts. And these 5 kind of scenarios that we used came from research of ethnographic research of urban youth involved in violence, where they described the kind of common things that go down that would lead to a shooting. These are data from one of those items, whether they thought it was okay to shoot a guy if he was dancing with your girl at a club. We actually gave 2 different scenarios. Would it be okay to shoot someone, or would it be okay to threaten someone with a gun? The NP column stands for McElderry Park, our intervention site. And if you look at the shooting question about what % thought that was okay, only 5.2% of McElderry Park thought it was okay, in comparison to the other 2 neighborhoods, roughly 14% thought it was okay. Those who thought it was definitely not okay, 84.5% for McElderry Park versus 68.1% in the other areas. If you look at the question about whether it would be okay to threaten someone with a gun in that context, again, you see very big differences between McElderry Park and the other 2 neighborhood sites. We summed the responses over the 5 scenarios to come up with what we refer to as sort of a shooting propensity score, your likelihood that you thought it was okay to shoot under a variety of contexts. And this just is a graph, simple graph of those summary measures. And again, you see McElderry Park with significantly lower levels of propensity to shoot. Because we like to get our stuff published in fancy journals, we had to do some sort of regression analysis. So we controlled for a variety of risk factors related to risk for involvement in gun violence: age, the arrest history, whether the person had ever been a victim of gun violence or had a sibling who had been shot or shot at. And we also, because a common way to think about how we develop what we think is okay, what's normative, has to do with what we think our friends think, okay? So we controlled for what, we asked the same set of questions and asked them, what do you think your friends would think would be okay? Would it be okay, would your friends think it would be okay to shoot someone if someone tried to dance with their girl at a club, or took your money or something like that. And still we found a very significantly lower propensity to shoot in McElderry Park intervention site compared to the non-intervention sites. So I'm now just going to give you an overview of what we learned as we examined the data from the police department on non-fatal shootings and homicides. We looked at monthly counts of non-fatal shootings and homicides for every single police post in Baltimore initially. We then looked at the top quartile, the top 25% of highest rates for non-fatal shootings and homicides, because we didn't think it was a very useful kind of comparison to compare very high-risk areas where the intervention is being implemented with sites that look very different in their whole experience with gun violence. The essence of our approach to estimating program effects is common to research of this type, where basically we're looking at change in the intervention areas relative to change in other areas that didn't get the intervention. We use negative binomial regression models with robust standard errors to account for the fact that the data are clustered by police post. And we also had controls for the number of arrests for drug-related crimes and for weapon-related arrests. These are typically arrests for illegal possession of firearms. And because gun violence in Baltimore and in many cities has somewhat of a seasonal dimension to it, there are changes over the calendar year. We controlled for calendar month. This is just a very simple, this slide shows a very simple comparison of the mean monthly number of homicides in McElderry Park versus non-intervention post. We also examine bordering areas. So the reason we look at bordering areas is that two different kinds of things could happen surrounding the area that you're doing intervention on. If you're a pessimist, you're worried about spillover. The shootings just gravitate to those other areas. If you're an optimist, you might even think, well, there could be potential benefits. So as I described earlier, there is a spatial dimension to gun violence, and it can spread. And if you're preventing shootings and homicides in one area, you could also have beneficial effects in surrounding areas. So what we found is that during the period of time for which we currently have complete data, and I admit to some frustration that I don't have more data now. It's not for lack of trying. We're trying to get more. The police department is very busy, I guess. But we have data through the through the third quarter of 2008. And through that period of time, McElderry Park did not have a single homicide during that period, so there was a 100% reduction. 59% reduction in the bordering areas, and that was compared to a 31% reduction in all other posts in that top quartile for homicides and non-fatal shootings. Now we have far less data for Elwood Park because they implemented a little bit later. This is a site adjacent to McElderry Park, as Lori mentioned, and there is no change in that particular site for how many months did we look at here? I guess we had about 4 or 5 months there. When we did the regression analysis, we found that again, this is these columns refer to incident rate ratios, and this is a number that in essence is 0. There's a 0 risk because there were no homicides in McElderry Park, and that was a highly statistically significant effect. Again, not surprising. The estimate was that the bordering effects were about 38% lower than what would have been expected without the intervention. However, that did not reach statistical significance. In Elwood Park, the estimate was in the wrong direction but was not statistically significant. We found harmful effects associated with Union Square when I ultimately write this up for publication. I'm not even going to put Union Square in the model because they didn't really implement the program. Now I'm going to show you some data for non-fatal shootings. The picture looks a little bit different, I'm sorry to say. McElderry Park had a reduction of 7% shootings following the implementation of the program. However, the reductions were greater in the non-intervention post. They had 23% reduction in non-fatal shootings. The bordering areas did have a 31% decline in non-fatal shootings. Elwood Park, not much change, nor were there much change in any of the other areas during that period of time. Regression estimates show no impact in McElderry Park on non-fatal shootings, a statistically significant reduction in Elwood Park, and again, a harmful effect of Union Square. But one thing I want to say also about Union Square, aside from them not really implementing the model to fidelity, is that estimates for program effect were very, very unstable. And it was a real close judgment call about what you assume was the month that they fully implemented. And if you change that by 1 month, the estimate completely flips to a protective effect as opposed to a harmful effect. So I'm not at all confident that those estimates from Union Square mean anything, really. There are a few other findings that I think are noteworthy. If you combine our two outcomes, non-fatal shootings and homicides, the reductions in McElderry Park were larger than those in the comparison areas. However, the difference was not statistically significant. I mentioned the fragility of the Union Square estimates. If you look at the two East Side areas that implemented the program and those border posts, and you looked at the target group of greatest interest, those people under age 30, there was a very significant effect in the hoped for direction. Also, when you looked at victimization for the under 30 group, it was interesting to me anyway that drug arrest was linked to more homicides. Now this was actually controlling for the fact that, you know, some areas are going to have both more drug arrests and more shootings just because they've always been that way. So we controlled for those baseline means. But after you control for those baseline means, as drug arrests went up in an area, there were more homicides, making me wonder whether that is the best strategy to addressing homicides. Conversely, arrest for illegal possession of weapons was associated with fewer homicides. And this is actually very consistent with other research that has shown that as risks for getting caught with a gun increase due to typically to police efforts, that shootings typically go down very significantly. Limitations of our evaluation to date. We have a relatively short follow-up period and few intervention sites in comparison to the Northwestern study in Chicago that had 7 sites with far more follow-up data. Our estimates are based on the assumption that the determinants of gun violence were unrelated to the intervention. So that's just sort of a common thing that almost any evaluation of any real-world program or policy bumps into. There were other initiatives that were implemented in the city in some of the areas where the program was operating around the same time that Safe Streets got going. We controlled for what we could through the police arrest patterns. We also controlled for the deployment of a new police initiative, something called the Violent Crime Impact Divisions, who focused a lot in some of these intervention areas. So we did control for those things, but there were other things that were going on in the city. A gun offender registry was started. The state started a new probation and parole program to focus on the highest risk individuals. Finally, we did not have, the police did not provide us with information on the age of the offenders, so that made it a little bit more difficult. We were able to look at victimization by age, but not offending by age. So conclusions and remaining questions. The most profound effect, and the one that I think I have most faith in, is that in McElderry Park, there was a very large effect on homicides. They went for 22 straight months without a single homicide, and you cannot find that in their historical patterns at all. We did some projections with our regression analyses and even accounting for otherwise reductions in homicides during part of that period citywide. We estimate that without the program, there would probably been about 6 more homicides than there were. There also seemed to be an association between the number and nature of mediations that were going on and the significant effects on homicides. I'm still puzzling a little bit why we didn't see the effect on non-fatal shootings. We are gathering more data for this year. We're going to look at data through the end of 2009. The trends in the east side don't look as good as they had been. There has been an increase in homicides in some of the eastern posts in the program recently. And this, from my understanding, has to do something with things going on with gangs. There had been truces going on, and those are fragile things. In the Cherry Hill site that was not in our interim evaluation, they only got going really in December of 2008. But when you compare the 2009 numbers to 2008, before Cherry Hill had the program, they are pretty big reductions. That just, my label somehow got off of here, but the long bar here refers to the number of non-fatal shootings and homicides in Cherry Hill, January, July of 2008 versus 2009 when the program has been in effect. So those are at least some promising trends to report in Cherry Hill. So our future priorities are to study factors relevant to successful implementation, because again, we see in Baltimore and we've found in Chicago that some areas had very big effects and some not. And we really need to learn more about what determines success relevant to implementation and kind of conditions in which the program can really work well. We are going to be in collaboration with the groups implementing the program, finally getting to survey outreach worker clients, and we hope that this will provide some guidance to program staff. And just in closing, I probably should have said this up front. I wanted to sort of dedicate this to Leon Farouk, who was the initial director for Safe Streets in East Baltimore. Leon passed away earlier this year, and a couple months ago, we gave him a Community Hero Award here at Johns Hopkins Bloomberg School of Public Health, along with Danté and the outreach team working in East Baltimore for the phenomenal effects that they had in saving lives in the communities that they work. We will take some questions now. Not sure. Yeah.
I was just, I mean, this is so fantastic, and I have so many questions and compliments for you all, but I'm wondering how many outreach workers you have and how difficult or easy it was getting the outreach worker piece.
Do you want me to get the numbers? In East Baltimore, with the 3 sites, we have 15 outreach workers presently, and in Cherry Hill, we have 4. That also includes an outreach supervisor, a site director, and what's called a violence prevention coordinator that does all of the planning of our events and the shooting responses. I would say it's very difficult to find outreach workers who have the dedication and passion. As Daniel was saying with Leon Farouk, he really has been a pioneer in Safe Streets, in the success of Safe Streets in Baltimore, in that he had the ability to bring in individuals who shared his passion and his commitment in a way that I find it has been difficult in our other sites. We have benefited from his expertise with Cherry Hill as well, and some other individuals who are currently working in Cherry Hill have done so for so long that luckily they're able to find the right people, but it is a very difficult process.
And we, like most of the outreach workers, like when we get a new outreach worker or a potential outreach worker, he'll be interviewed by the outreach workers first, you know, and basically we'll have an understanding like who this person is if one of the outreach workers bring them to us, and we'll, well, who is he? You know, some of us may know him, some of us may not, you know, but most of the time, most of the outreach workers may know the person. And then we do an intent. Are you finished with the streets? You ready to come on this side? Blase, blase. Because they have to be somebody that they're used to seeing doing the stuff on the other side. And then they have to see that transformation. Because most of the time, like what we do now, you have to be out of trouble for what, like a year or two now? So, you know, we're not just going to get no anybody. We have to see like that you're going to be dedicated to this because, you know, people's lives at stake, and we don't need nobody just sitting on the fence, you know, because something can, you know, happen, you know, in this kind of work. But he had to be passionate, and we could sense it when we got him at the table, giving him the interview.
Yeah, I think getting the right people really, you cannot overemphasize that, and I don't know if there's any more Lori or Danté want to add to sort of the process of trying to identify and screen those individuals. But one of the things that was biggest thing that I've learned since working on this project is, you know, being an academic, we focus on stuff like theories and data, and I don't want to downgrade data. Data is connected to lives. So, you know, there's some Greek letters and some of the regression equations and stuff like that, but those are people's lives, okay? We can't lose sight of that. But the quality of the character of the individuals doing that is something that, again, we academics have a harder time to get our hands around and understand, but it's clearly central. And that's been my personal observation so far in Baltimore, and I'm guessing if I would debrief some of the researchers in Northwestern, maybe I'd hear similar stories. Young lady right here.
Piggybacking on that question, and maybe this question is best answered by Danté, do you believe that there are individuals in all of the communities in Baltimore that need this program, that could come forward as outreach workers, or do you believe that there are just some communities that aren't in a place where they can find people to become an effective outreach worker to grow a successful program?
Yes, I think it's probably outreach workers in every neighborhood, you know, in the whole, probably this whole country, you know, and all of those neighborhoods where violence is, you know, because you got guys like, you know, the average drug dealer doesn't want violence around his, you know, where his business taking place. You know what I'm saying? So, you know, you got other guys that are around, you know, that's not selling drugs, that don't want that kind of stuff. So we just gotta go find them, but they're there. You know, like it's other outreach workers for this area. If we had the funding, I'm quite sure we would have them, because it's guys that I know personally that's walking around right now and be like, man, that's a beautiful thing. I don't know who thought of that, but that's a beautiful thing. I wish I could be part of it. And you know, they might come volunteer or anything. You'll see them at shooting responses. They might want to take the ball on and say something, but they're not employed. But like, you know, you got to know it's guys out there like that, you know, and once you put that kind of information in the neighborhood that you looking for guys like that, and I think they'll surface. But I'm quite sure it's guys who want to see something different, because I know I did. You know, I've been through a lot. I got friends call my phone, man. I don't have the money to send to them to Texas and Oklahoma. So I don't want to see that keep on happening, you know, because, you know, you lose a lot, man. With this violence and all this stuff going on, we losing a lot, you know. And I think there's guys everywhere that wants to do this, because people like pretty fed up. Like, you know, as you get older, you know, guys just start getting fed up. Like, man, I got to do something. You know, something got to change, you know. So they everywhere. We just got to find them.
And I would say in our panels, in our interview panels, the majority of the individuals that we've hired all say the same thing, and that they've been doing this work even before Safe Streets began. So they've, you know, been trying to tell other individuals in the community that things have to change.
Yes.
I'm very concerned about the public schools in Baltimore City, and you mentioned outreach, and I think at one point you said you were in the schools. Of course, given your hours from 6 p.m. to 2 a.m., can't do much of it, but how much work are you doing in the public schools?
Well, not that much, but like if someone calls on us, you know, the health department will call us and say, well, we got a little guy, he in some trouble. Like Leon Farouk, rest in peace, he passed away. But me and him, we used to go into a lot of schools. And it was this one young guy, he was like a Crip or something. But he was only like 11 years old. And he wanted to get out. And he didn't know how to. And, you know, we went to the school and talked to him. And, you know, I told him, I said, man, why don't you just go around there and just ask him, can you get out? I said, you 11 years old, I don't think they're going to just, you know, do too much to you, 11 years old. You know, and he talked to him, and I talked to him. He went back around there. It was a process, but he eventually got away from it. But what he had to do was change his environment. You know, you can't go around to that playground with them guys hanging there, because you still going to be with them. You know, even though you said you're not that, if you're around them, you're going to still be that. So we go into school, stuff like that, when people want us to, you know, and I have no problem with talking to the brothers, because I think, you know, my story, like, a lot of people associate, like, my name with violence. Like, my family was real, I mean, whoa. But, you know, so to see me in this light, you know, people, it's hope, you know, because I mean, I could have been some stuff. You know, so I feel like my story, you know, is like powerful for like little young guys like that in school and stuff like that.
Does the contact have to come through the health department, or could
Yes,
it come
it has
from
to
the
come
school?
through like what? Bridget, our violence prevention coordinator or something like that. Or the health
We mix it
department.
up, to be
They
honest.
mix
I
it
mean,
up.
a
They all-
lot of the times it does come through the health department, because then at least we can make a determination as to which site would be the one that should go out depending on the location. But we have had, our sites are actually contacted for assistance in matters like that. When there is some sort of issue, when there's a gang issue, we've had schools contact the sites directly. Most of the work we do in the schools right now is really speaking engagements, talking to youth about avoiding getting into that lifestyle in the first place. But since we focus on the highest risk individuals, 9 times out of 10, that's the work in the communities and in the streets. But the staff are always willing to go and help out when asked.
So I don't want to monopolize, maybe take the first question. People who haven't asked a question yet. I was curious if you could speak to what's happening with young women in this same age group. Like, where are they in this picture, or?
Well, through some other research done here at the school, you know, we've definitely seen very high rates of girls' involvement in fighting and violence in Baltimore, at rates fairly comparable actually to boys. What really distinguishes the two, boys versus girls violence, and what the data that I've seen, frankly, has to do with the males use guns and the girls use fists or knives. And far fewer are dying in the fighting involving girls, because the boys have the lethal weaponry the mortality rates aren't really comparable. The vast majority of young people who are dying in our city and in most cities are male.
We do have female outreach workers that do carry caseloads of female participants. So we're not just working with the highest risk males, we're also working with the highest risk females.
And I don't want to convey the idea that girls or young women have no role in this. In many of the kind of scenarios that get played out, they play very pivotal roles, but they're typically not the ones pulling the trigger. Would that sound right to you?
We do have some questions from our online audience, and for those of you who are watching online, I just want to remind you, you can email a question in to us at our email address at MAPHTC, which stands for Mid-Atlantic Public Health Training Center at jhsph.edu. And the first question is actually for Danté. And the question is, you said that it's therapy for the outreach workers to be involved in Safe Streets, and wondered if you could just expand on that a little bit and talk about what you get out of it.
What I mean is by therapy is like, you know, when you get to explain it to a young man about life and about, you know, using guns to resolve your problems, it makes you like reflect back on, I know my lifestyle, you know, like we used to do a lot of things, you know, so like, as I'm talking to a young man, I'm not just talking to him. You know, I'm speaking from experience, and I'm speaking to myself. And, you know, being as though my awareness has been raised, you know, like, I don't think like I used to think before. So as I, you know, convey a message to a young man or a young lady about, you know, reducing violence, reducing killing, shooting, stuff like that, the need for education, getting a job, stuff like that, you know, I find that kind of stuff working inside of me as I'm telling someone. Because, you know, I used to always tell the brothers to go back to school when I first started working for Safe Streets, and then I found myself, I went back to school, you know, and, you know, it's just like I said, it's therapy for us too, because it constantly, you know, has you thinking about what's going on. Like, because at first it was like, you know, I really didn't care about, like, somebody gets shot, I'm selling drugs, I'm over here, he gets shot there. All right, it didn't stop what was happening on my block, so I ain't even concerned. But now that I work here, and I work for Safe Streets, and I'm out in the community doing this kind of thing, you know, now I care. You know, so as opposed to not caring and caring now, that's what I meant by the job being therapy, because at first I was just, you know, I would probably be just as cold, you know, to the situation, somebody getting killed over there, you know, like, well, it happened over there, it ain't happened over here. So, you know, that's what I meant by therapy. You know, it helps me out as I'm trying to help someone else out.
Okay. We also have a question for Daniel. Given that the shootings go down when people are more afraid that they will get caught with guns, why don't you put all your efforts into getting guns off the streets?
I put a heck of a lot of my efforts towards getting, I mean, I obviously can't be the one to do it myself. I've ridden around with some of the police units years ago that were sort of solely dedicated to exactly that, and I've seen some of that stuff in action, and it's very important work, and we do a lot of work with Baltimore City Police, and actually police in other cities throughout the United States on strategies to getting illegal guns off the streets. And so I can't underscore how important that is. But the beauty of a public health strategy to this problem is because there's multiple causes here, there are a lot of different approaches you can take. Gary Slutkin, when he designed the particular intervention we're discussing today, came to the conclusion that, well, as a public health person, there's not a lot I can do about how many guns are out there. We're going to focus on these other things that are also critically important. But in my mind, particularly in the most dangerous neighborhoods, in the most dangerous kind of cities, you really need the two working complementary. And the last thing I'll say on this is I'm going to sort of respond to a question that I haven't gotten, but I'm guessing will be in the minds of audiences, individuals who work in health departments in the region, which is, you know, all of our budgets are being cut and, you know, everything's being pared back. How in the world could we take on gun violence too? You know, we're dealing with the flu and HIV and all kinds of other things. And my response to that is that look at your mortality data. Look at where the health costs lie, and go to your city leaders, to your foundations, and say, we can play a positive role in this. Law enforcement is one very important tool to get the guns off the streets and anybody using them inappropriately. But there are other approaches that can have very demonstrable effects on one of the most important urban health problems that we have in the country.
Okay. And then there's another question, I guess, that for any of you. There's been a lot in the news about the downside of Safe Streets in Chicago, specifically how some of the caseworkers have been pulled back into their former lives, and wondering if there's been any of that experience here in Baltimore.
I can say, I mean, I think that along with any type of job, there are individuals who do things that result in them no longer having that job. I don't think that because you're an outreach worker, people may view your chances as being greater if you lived that lifestyle before. So I can't really speak on everything that's happened with Ceasefire, although in my opinion and in working with them, they have a very large staff, much larger than ours. So if there are individuals, if they have 100 outreach workers and 2 or 3 have maybe unfortunately gone back to that lifestyle, I don't know how much of a downturn that is. I will say with Safe Streets here in Baltimore, the thing that Chicago actually stressed to us was if people are hired and take on this role and then at some point in their life or some point in their work decide that this just isn't for them yet, they're just not, they can't do this yet for whatever reason, that, you know, we've asked or we've hoped that people would bow out gracefully, and we have had that in Baltimore, and that's all we can do really is continue to hire individuals that we believe in, that are credible, that are telling us that they've changed their lives and that have shown that. And then unfortunately, if something does arise where they do go back to that lifestyle, they would no longer be with Safe Streets, but we would hope that they would bow out gracefully prior to that.
Let me draw an analogy that at least works for me. I don't know if it will work for you, but on a fairly regular basis, we will hear news accounts of police officers who are arrested for a variety of things, domestic violence and Lord knows what. When that occurs, does anyone ever suggest we need to shut down the police department? Because some of the people who work for them are getting arrested for doing illegal things. Of course, it's a preposterous idea. It's the same thing as a criticism for Ceasefire or Safe Streets. If one person goes astray, that does not mean that the program might not have public safety benefits.
Okay. Are there any more questions in the live audience? Okay, we do have one more online question. The number of youth victims from homicides is often cited as an indicator of youth violence. What percentage of youth who die by homicide are victims of other youth? In other words, how many are youth are perpetrators of those homicides?
It's a difficult question to answer, in part depending on how you identify youth. If you look at juveniles, those under 17, and who most commonly kills juveniles, it is actually not another juvenile. It's more typically a young adult. And the reverse is also true. When a juvenile kills someone, more commonly, they're not killing another juvenile, they're killing a young adult. And it's part of it has to do with, there's nothing magical about these little age demarcations that we put down of, okay, 18 is, this is juvenile versus not. But generally, youth-involved gun violence, they're relatively young people on both ends of the gun there. If that's, I hope that addresses the question.
Okay. Any other questions? Okay, I really want to thank all of our presenters for a terrific presentation today. And thank you all for coming, and I hope we see you again next month. Thank you.